Okay, I want to know just two more questions. Paula's big ideas around healthcare. And one of them is just expanding on something that you shared with me. And I hear different variations of this statistic, but they're always eye-opening. Is that you mentioned that 73% of healthcare expenses go to the middlemen, right? Only 27% go to the actual people that are delivering care. Can you, for our audience, explain the math here? And the numbers I've heard are both just a little bit above or a little bit below that. So absolutely, that seems accurate. And many people don't understand that math. How could that possibly be? And of course, direct pay is a direct answer to taking out this middleman. But why is it 73%?
Well, because the management, again, healthcare is costly, medicine is less costly. As we've moved away from expensive places, like think of cancer therapy, right? You used to get admitted to the hospital, get your induction therapy, and then go home. You know, it cost all those days in the hospital, all those people involved. Now you get a pill, right? That's made for you, and you take it at home. So the cost of the pill is one thing, but then the cost of delivery of that care is much lower,
Mm-hmm.
right? You know, we used to admit patients to the hospital before surgery, keep them in the hospital after surgery till their staples came out, went home. Now patients go home immediately, right? They don't get admitted to the hospital. So now the post-op care is really, the family has to do that, right? That's where social determinants of health come in. But the cost of that delivery, the cost of that system has come down. So that's why, you know, the pendulum kind of shifted, because that 73%, think of it as that 73% being that kind of clunky, keep the lights on this big building, right? Say you have a big building, but all of your employees are now remote. But the big building still requires, a company is still paying the electric bill and the gas bill and the cleaning service, right? To keep the big building going, but your employees are at home. So only 27% of that of your cost is, you know, you only need to spend 27%. The rest of that 73% is putting into a system that you don't need anymore. That's how I like to think of it, right? It's like, not that, oh my gosh, we have to take, the middleman is taking all of it. It's like that 2/3 of what we spend is no longer necessary to spend. You could repurpose that money somewhere else.
Right. And technology and medical innovations have made it such that those
And
two-thirds are not
exactly.
necessary to spend.
It's kind of a
Mm-hmm.
different take on it. It's not like,
Mm-hmm.
oh my God, medical care should be 100%. It's like, well, we're only using 27%. We don't need it. We are more fuel efficient. Right? We are more fuel efficient. We don't need to fill our gas tank with the extra 73% anymore. We don't need that. We need to modernize and use technology to streamline it, because at the end of the day, medical care is finite. Right? It's finite. Now, part of that 73% is the marketplace of healthcare. That we have very little control over. You know, that's where the drug
Mm-hmm.
companies can decide a generic drug could be really high priced or low priced, and they're going to just set their margin, because that has to do with the way business is practiced these days, right? Forced obsolescence of technology, so that you buy another phone or you buy something else, right? We know that there's business practices that are designed in a boardroom to make money, right? To make a margin.
Mm-hmm.
When it comes to medicine, that's hard to sell. It's just not something people want to digest, right? You don't want to pay an exorbitant amount for this miracle drug that's saving your life, and say, well, we can save your life, but now the price is up to $200,000. Now it's $300,000. Now it's $400,000, right? It's like prices for medication should not be set supply and demand, and they certainly should not be manipulated by middlemen. So that's that 73%, right? So if the healthcare dollar, which is heavily subsidized by the government, continues to pour money into the system, they can stop the flow of cash to that 73%. They can say, we don't need to keep that lights on in that building anymore, right? We don't need to keep the electricity on. We don't need to, keep the air conditioning going 24/7, right? We don't need to waste all of these resources, right? We can shut all that down. And that's where the government comes in, because 50% of the healthcare, of the federal budget goes to healthcare in one way or another, either directly through Medicare or Medicaid or indirectly through Federal Blue Cross to their employees, or paying for TRICARE for their military, right? 50% of the federal budget is going to healthcare, and a full 73% of that goes to middlemen. That means 1 out of 3 of our tax dollars is fueling these inefficiencies. We can vote on that and say we don't want that. We do not want. We take that extra tax dollar and put it somewhere else. But don't put it there. And that's where the government can come in. You know, government doesn't do well with healthcare in general, but government does well for consumer protections. And we are the consumer. And as soon as they recognize the patients are the consumers, put in consumer protection laws for us.
Yeah, that makes a lot of sense.
And protect our privacy, our data along the way.
Yes, right, exactly. Yeah, gosh, a lot of bad actors in the ecosystem, and yeah, for the. Mm-hmm.
Yes, but again, you don't take down a system. You create an alternative, and you let the market force drive it. Because ultimately, there'll be a hybrid. You cannot eliminate insurance. You need insurance. Insurance is important, you know, and it's especially important for your health. You do not eliminate it. You just bolt into it a direct pay model in addition, where some of the small stuff you pay out of pocket and the big stuff you get covered. And that's fair. Pay all the small stuff means when you go to the hospital, there's no deductible. Right? When you need that cancer therapy, you get it. There shouldn't be an argument. But the small stuff, sure. You know, go to your doctor, pay a few $100s, right? Go to that ear specialist, right? There's stuff that we can afford to pay out of pocket, and that's how countries that are like socialized medicine work. And for poor people, give them a voucher. Give them health care vouchers. Why does subsidized Obamacare has to be all 100% through an insurance managed care model? You know, do we really need all these managers? I would argue
73% worth. Right.
73% worth, and it is a system. But think of all the money that we would save. So at the end of the day, do doctors need to be paid more, or hospitals need to be reimbursed more? No, we need to lower our overhead. Eliminate all of these, because every middleman is taking a piece that requires us to give them data for. Right? We have to take steps in the way. If we knew we could eliminate a lot of our cost of getting paid, we wouldn't have to raise our fees, because basically, what does it matter? It's a margin.